Reading the ECG heart monitor lines, the complete guide by UPOlife. An electrocardiogram is also known as ECG or EKG as a device that records the electrical signal from the heart and is used as one of several diagnostic tests for cardiovascular conditions. Doctors use ECG heart monitor lines to evaluate a person's heart function to determine whether their heart disease has aggravated or not. Overall, ECG is a representation of the heart muscle's electrical activity, and it changes over time. Although it seems complicated, reading the ECG heart monitor line is simple, and we're going to guide you through it. Proper ECG interpretation depends on understanding the following aspects. The P wave is the heart wave that represents depolarization of the left and right atria and corresponds to atrial contraction. The absence of P waves and the presence of irregular rhythm indicate atrial fibrillation. The QRS complex represents the electrical impulse as it spreads through ventricles. It starts before ventricular contraction. Pay attention to the width, height, and morphology of the QRS complex. The width can be narrow, less than 0.12 seconds, or broad, more than 0.12 seconds, while the height can be small or tall. Morphology is assessed by focusing on individual waves of the complex to look for isolated waves or any progression in their representation. T wave represents the repolarization of ventricles. T waves are considered tall if they are bigger than 5 mm in the limb leads and bigger than 10 mm in the chest leads. Tall T waves are associated with hyperkalemia and hyperacute STEMI. Amplitude measures the voltage of the heartbeat, expressed in the vertical dimension, measured in millivolts. For example, 1 millivolt is represented by a deflection of 10 mm. Deflection, the average direction of electrical travel. A wave of depolarization traveling to a positive electrode results in positive deflection, whereas a wave depolarization traveling away from the positive electrode shows negative deflection. Duration measured by squares going horizontal. When it comes to heart rate itself, normal heart rate ranges from 60 to 100 beats per minute. While more than 100 beats per minute points to tachycardia, but less than 60 beats per minute points to bradycardia. Reading ECG waves labeled on the paper, and all the values are not as difficult as it seems. This simple 12-lead ECG protocol can help you to determine the heart rate and tell if the heart rhythm is fast or slow. Also, it can help to detect whether the heart rhythm is regular or irregular. For example, you can use a piece of paper and pencil to track P waves and QRS complexes to see if they match or have gaps. Irregular rhythm is indicated by a recurrent pattern of irregularity, or it is completely disorganized. Additionally, it can help to examine street segments for any elevation or depression. The Saint segment is the part of ECG from the end of the QRS complex to the beginning of the T wave. It remains isoelectric. Elevation or depression of Saint segment indicates cardiac pathology. The cardiac axis represents the overall direction of the electrical spread within a person's heart. In healthy people, the axis spreads from 11 o'clock to 5 o'clock. For this purpose, leads I, 2, and 3 are used. The normal cardiac axis is indicated by lead 2 having the most positive deflection. Right axis deviation occurs when lead 3 has the most positive deflection and lead I is negative. On the other hand, left axis deviation is represented by lead I as the most positive deflection, while leads 2 and III are negative. The PR interval is measured in units of time. It represents the time from the onset of the P wave to the start of the QRS complex. The normal PR interval value should be between 120 and 200 ms. When analyzing the PR interval, you need to bear in mind the following values. A prolonged PR interval of more than 0.2 seconds indicates the presence of atrioventricular delay known as AV block. Shortened PR interval means that the P wave is originating somewhere closer to the AV node. It can also indicate that the atrial impulse is reaching a ventricle through a faster shortcut rather than conducting slowly across the atrial wall. Conclusion: reading the ECG heart monitor line is easier than it looks. It's important to learn what waves and values represent to determine if the results indicate normal heart function or potential disruptions. Learn more about how to evaluate your heart health and manage your heart condition at home by visiting UPOlife.com.